Good morning. This is Dr. Hatt here, coming to you live from Posh Place. What we're going to talk about today is we're going to address obesity for your pet. From a veterinary standpoint, the important things to discuss about obesity are the health problems that can come up. That's going to be one thing we're going to talk about today, are health problems. The second part is one of my most favorite aspects of veterinary medicine, and that's the human-animal bond. So the first part that we're going to talk about as far as health is going to be what happens if my pet gets overweight. And this can happen at any age. Sometimes it can happen, we have a medical term called iatrogenic or iatrogenically, which means usually medically induced, and that can be typically from being surgically sterilized, spaying or neutering. What happens with that is the hormone balances will start to drop and change, and I will indicate or use sort of something along the lines of where you can relate to, where I'll say it's almost like putting your female dog into menopause. Everything kind of slows down. So in those cases, typically I'll advise to reduce the portions of food by almost 30%, because just calorically they cannot metabolize as efficiently as they did when they were intact or unspayed. The neuters are the same way. The testosterone really works in those males and keeps them nice and lean and very, very active. They've got to patrol their home range. They've got to check where everything's at. And once they're neutered, I call them, those are the dad bods that start up, right? They're married, they're happy, they're at home, they're going to kick it on the couch. And so those hormones have kind of dropped down, and they're not needing or feeling the need to be so active anymore. And if you don't drop that portion of food down for them, then they too will gain weight. At that point, you're going to your veterinarian, you're doing your blood work annually, right? Because a lot can happen in a year. A dog will age on an average of about 7 to 8 years per one human year. And so there's a lot of changes that can happen. Consider yourself at the age you are now. In about 7 years, wouldn't you want to have some blood work to see how you're doing? So now you're doing that annual blood work. You're also checking the urine on your pet as well. And what that's doing is that's giving your veterinarian an annual indicator on the metabolic or internal health. You'll hear me say in my exam rooms, I want to make sure the inside matches the outside. What am I looking for? I'm trying to check and see if your pet has diabetes now. I'm trying to also find out if their pet has a thyroid problem. This can be other things that happen as your pet ages. Another thing to consider as your pet is becoming older is pain and arthritis. And so one of your signs that you can really look for is, does your dog still get excited to play with you? Or does your cat still interested in her toys or his toys? Does he jump up to the top of that play structure that you got for him? Those are some really subtle signs, honestly, in your busy, busy life that you notice that your pet would rather cuddle with you than play. Or they want to go for that walk, but the walk just isn't as far. And we'll overlook or we'll justify it with, well, they're just getting older, or my dog's just lazy. Not necessarily. You are what you eat in the animal world, just like in the human world. Are you feeding your pet the right food? And are you feeding them the correct portion? Your veterinarian will have some prescription diets that are available. Hills has a product called Metabolic Diet, which is wonderful for the dogs and the cats. You do need, or I do recommend that you have a full blood workup, which you're already doing, but just making sure there's no other issues happening with your pet, because your dog or cat will start to reduce weight. Okay, and so that's Metabolic Diet from Hills. I do believe Royal Canin also has one called Satiety, and so those are really important, for just keeping that weight down. Next, I want to talk about the cats. Cats, diabetes is an issue for them. Arthritis pain is an issue for them, but they have some interesting GI issues too. They will have issues such as constipation, or even have urinary tract infections. If you are a cat owner, you know that cat is OCD about grooming themselves. And so these cats also will take care of themselves and lick their backsides and keep it clean. If they are so obese that they cannot get back there and groom, then that is just a little petri dish area for urinary tract infections, and also for for GI infections as well. But the main concern for these guys GI-wise is going to be constipation, and they will need supplemental diets, and typically the solution for them is a weight loss diet because it's high in fiber. So that will really help that pet out too. One of our food companies, I believe it was Hills, that actually did an excellent job with doing some research by doing the calorie math, okay, the caloric math, and comparing it to a 5'4" person, and measuring their caloric needs and how it would affect them versus a cat or a dog. So I'm just going to put on my reading glasses here so I can go over this with you. So if you were to give a 10-ounce or a 10-pound cat a 1-ounce piece of cheese, that equals, for that 5'4" person, 3.5 hamburgers or 4 chocolate bars. Also, some people think that cats actually like milk, which they tend to like it. However, it's very high in calories for them. 1 cup of milk, okay, 1 cup, now measuring cup of milk, or 1 glass of milk, is equal to 4.5 hamburgers or 5 chocolate bars. That's terrible. And then what's that cat doing? Going up to wherever it can get to and curling up, or just sunning itself in a little sun puddle and just gonna nap that off. I mean, who wouldn't eat a nap after 5 hamburgers? So and then to give you some perspective, some of the diet treats, they specifically use their product called Metabolic. And that is, if you gave 3 metabolic treats, that's the equivalent of half an apple. Do you see the difference? So a little too high, something that seems very innocent and small is actually not small, because you have to consider that while mammals are mammals, their metabolism and the way that they digest food is different than a human being. Now our 20-pound dog getting 1 ounce of cheddar cheese because he stole it from the cat, right? That's the equivalent of 2.5 hamburgers or 5 chocolate bars. 5 chocolate bars. That's terrible. And if they were to get, let's say, a small oatmeal cookie, because you're not giving them chocolate, right? We all know that's terrible. Well, now, so you're compromising with a small oatmeal cookie. That's the equivalent of 1 hamburger or 2 chocolate bars. So these are additional treats that you're giving on top of their daily portion of food that you're feeding once to twice a day. I know that we all have in common the fact that you love your pets, and that having them together with you and those beautiful eyes, the way they look at you, and they're just like, please share that little piece of bacon or cheese or toast with butter on it. But when you're bringing them to your vet every year, and when your vet's looking at you, well, talking to you over the phone at this point and saying, Fluffy has gained how much weight? You got to look at that, all right? And so, and what you're doing is actually not contributing to the love and longevity of your pet, but actually the hurt, okay, in the future. This is one relationship where you are directly responsible for the longevity of your pet when it comes to obesity and all the other diseases that can come along with it. Another thing that I have done, because I myself have an obese pet at home, is I will take his cat food and I will throw it on the floor, so he actually has to walk to eat it all, okay? In a multi-species household, that requires a little more planning and choreography to keep the dog away from the cat food and so on and so forth, so that you're not adding to the other pet's caloric intake. However, it can be done. If you're committed, it can be done, all right? Those cats normally can inhale their food pretty fast, so they're really not hurting for that long. On the, if you want to try to cut back on the diets that you currently have now, because it's got some vanity weight, right? 5-10 pounds overweight. What you can do is look at the bag and look at the amount of food that you're feeding compared to what it says on the bag for the ideal weight of your pet. That's one thing you can do, all right? I usually have a standard rule of 1 cup of food per day per 10 pounds of body weight. Really talk to your veterinarian about your puppies as they're getting older. Usually it gets into this sort of 10 to 12 month mark. Sometimes their weight starts to level out a little bit. There are some nutritionists that will advise continue to feed the puppy food anyway, because they're still very important value, but you might cut back on your portion because your dog is no longer growing, up, it's growing out. And so that's really important. Also with your training, Keep in mind that you are adding calories when you're training them with those fun little hot dog treats or little sausages or whatever fruits, because you really want them to, you're trying to reward very good behavior. Well, you're also adding calories at that point, so you may have to cut back the bowl portion to allow for that relationship to happen. Hopefully that will help you. I know it's helped my pets a lot. You have a lot of resources available to you to combat obesity in your pet. It's a new year. Get your pet feeling great, get you feeling great, not only for the relationship you're having with your pet, but what you're doing to advocate for their longevity and quality of life. Thanks for joining me today for Chat with Hatt. I look forward to talking to you later. Bye.